Hello, my name is Dr. Stephen Clark. I'm a bariatric surgeon at Community Hospital South. My motto in life is that the chief cause of failure and unhappiness in life is trading what you want most for what you want now. The thing I enjoy most about bariatrics is the transformation that the patients undergo. It's really quite amazing to see someone who has struggled with their weight for a long time, has tried valiantly but unsuccessfully to be able to lose weight, and then to give them a tool that they can utilize to get that result. It's really quite amazing. I remember the very first patient I did, she came back 6 months later and she was ecstatic because she could now squat down on the floor and get up without assistance. Something as simple as that, which we would take for granted, made a big difference for her. Well, most of the time away from the office is spent with my family. 3 of my children play soccer, and I also played soccer when I was younger, so I still play in adult league. And then I have to shuttle them back and forth to their activities. My wife runs marathons, and so we are a fairly physically active and busy family. I think what I like most about being a physician is the same thing that I enjoy the most about bariatrics. It's having someone have a problem, come to see you, and you're able to provide them with a solution. They get better, you see them back, and they get back to resume their normal life, and they go about their merry way. And that's very satisfying. You know, being a physician is exercise in delayed gratification. So it's very nice that I don't have to do that with my patients, that I'm able to get gratification from their getting better almost immediately. The sleeve was recently developed as a first stage of a 2-stage procedure called a duodenal switch, but that what they found out is that people were losing enough weight with just the first stage, the sleeve, that there was no reason to do a second procedure. It had some of the attractiveness of the sleeve is that there are no what we call connections or anastomoses, so you don't get any of the dumping syndrome. People seem to tolerate it better. They can take extended release medications. Now the question is it going to be as durable long term as the RU is? So far the numbers look good, but that's a question that's still being answered. The RU is usually done as an inpatient, although people can be done as an outpatient, meaning they go home in 23 hours. The sleeve is designed to be a 23-hour procedure. However, if someone needs to stay longer than 23 hours, that we make arrangements for that. The band is almost always done as an outpatient. I can only think of one person, 1 or 2 patients that I've operated on in 10 years that have needed to stay more than one day, more than 23 hours for a band. And most of the band patients actually go home the same day. They don't even spend the night. When we first meet the patient, we do a presentation that goes over bariatric surgery and obesity and then the procedures that are available. After that, then they get to meet with either the physician or physician assistant who will do a complete history and physical. They will also talk to the dietitian and get started on their psychological testing.